Hello, viewers. Welcome to the webinar in this conference here. Thank you, everybody, for coming here. Today, we are presenting on augmenting care with integrative medicine in the pulmonary clinic, and you could potentially take this beyond the pulmonary clinic into your daily lives. Okay. So the first slide talks about integrating cultures into medical practice. In a city like New York, which is a melting pot of so many different cultures, it's important that we encourage and embrace diversity and cultural competence. And evidence-based medicine is not just learning the best evidence that's available, but also any care that you give has to involve patient values and preferences and clinical expertise. Today's highlights are going to be talking about health as not being the result of practice or consumption of a single commodity or activity, but it's a marriage of mutually balancing habits. A little bit of adventure and a little bit of rest, for instance. Traditional and complementary medicine ways of living is something that I'll touch on. Integrative and functional medicine, and trying to see if we can gather some data on specific diet and lifestyle intervention programs rather than generic advice like carbohydrates, fats, and proteins. Ask a patient about ongoing use. Potentially, they're already using it. Try to document evidence if possible in the form of case reports. And learning also about epigenetics, which is nothing but the exposure or risk factors in your patient, be it natural elements, man-made products, mind, body, spirit experiences such as stress, and what the impact on the human genome is. Well, allopathy has a deep plane of understanding symptoms, signs, risk factors, but there's some generic lifestyle and diet advice that we have available, mostly drugs and surgical intervention. Driven by pharmaceutical industry, of course, we need allopathy, we need conventional medicine. It's so essential in this world currently. And we expect cure or apparent control of underlying disease. However, in integrative traditional medicine, there is a much deeper understanding of body constitution. For example, in many different systems, Greek, Roman, Arabic, Indian. For example, in an Indian system, it's called the dosha or prakriti. Imbalances, yin and yang in Chinese medicine. And the epigenetics is also available in traditional medicine. Personalized lifestyle exposure and diet advice is definitely a key ingredient of traditional medicine, with a little bit of herbs, spices, and activity intervention, such as mind-body balance. And here, the difference is we are enabling the self-healing or self-balancing power of the human body, which is the intellect that we have. Of course, there's conflict of interest, competition from different industries. Herbal industries are also becoming really big these days, and pharmaceutical industries, of course. Sometimes patients may be shy, to disclose the use of such complementary methods. So what are the complementary, methods or integrative medicine components? Nutrition. Unfortunately, nutrition has become integrative medicine. It should be part of conventional medicine. Much deeper level of understanding is needed, and research is ongoing. But I'm glad that we are bringing in all different aspects of nutrition from the worldwide and trying to see if we can incorporate this into our lifestyle medicine, right? Nutrition, lifestyle coaching, exercise and movement, manipulation in the form of massage or chiropractors, acupuncture in traditional Chinese medicine, Ayurveda, which is Indian traditional medicine, plant-based medicine, mind-body techniques, meditation, biofeedback, hypnosis. These guys form a major component of things such as PTSD care in veterans and so on. Guided imagery for anxiety, panic attacks, visualization, breath work. The field of health, according to Duke Integrative Medicine, is where on the outer aspect we have conventional and complementary approaches where the physician takes over a lot of the role. Slowly you go inward towards the patient being the responsibility, right? You shift the responsibility to the patient. Relationships, communications, physical environments. What kind of environments do they choose? Spirituality, mind-body connection, movement, exercise, and rest. Trying to find a discipline in life, a balance to things that we do. Nutrition, personal and professional development, and trying to balance career and health importance. Let's see what the origin of integrative medicine is. Well, this word was born, integrative medicine was born when the program of integrative medicine was started at the University of Arizona. As part of this program, an integrative medicine clinic was established. And now, University of Arizona is one of the few institutes in the country that's certifying physicians as integrative medicine practitioners. ABOIM, American Board of Integrative Medicine, is one of the boards. And there's preventive medicine, there's functional medicine, lifestyle medicine. So you can get certified in any of these and try to find your own niche. Well, let's see the history of integrative medicine. What was there before? Well, Egyptian medicine was the start of medicine, being documented in 3000 BCs, and 2500 BCs over to Ayurveda and Unani medicine. Traditional Chinese medicine in the 1600s BC, Hippocrates, form of Greek medicine, 800 BCs. Roman medicine, 27 BC, 622 AD with Arabic medicine, Western medicine in the 1700s AD, man, and now integrative medicine. Functional medicine is a subset of integrative medicine, or a cousin, if you will, which works on functional systems rather than structural systems. And of course, we look at mental, emotional, and spiritual aspects of the human body, right? And we split the function into different systems such as assimilation, structural integrity like skin, communication, endocrine. There's feedback loop in the form of communication, right? Transportation, cardiovascular, and lymphatic system. For example, a simple technique, trampoline, right? Or the Bosu ball, where you jump or gently vibrate, is such an important technique that's being given to us from functional medicine. Okay, let's see how many people are actually using complementary and alternative medicine in the USA. Well, surprise, 4 out of 10 adults that you're going to see in the clinic are going to use complementary or alternative medicine. 1 in 9 children, man, that's a lot, right? But then you need to understand, wait, what is the definition of complementary? What do you mean when they say that they're using a complementary method? Well, this can range from anywhere from natural products such as fish oil, echinacea herbs, ginseng. Indian ginseng, by the way, is called ashwagandha. I just learned it. Ginkgo biloba, a range of such natural products, fish oil, and omega fatty acids, right? All the way to diet and lifestyle programs. For example, paleo diets, Ornish diet programs, which I'll be talking about soon, over to exercise and body mind balance programs such as yoga, tai chi, and to all the way to whole systems of medicines that can be accessed, such as Ayurveda, Chinese medicine, acupuncture, and so on. So 36% to 38% as of 2007, and now probably it's even higher. Okay, and 11% of children are using it. And this group from NIH is really killing it. They're using a lot of data points to figure out what's the current use of complementary and alternative medicine. For example, looking at yoga, okay, 2000, you see here 2012 compared to 2017, the blue and the gray, much higher, right? Yoga has increased from 3.1 to 8.4%. Meditation has increased from 0.6 to 5.4%. And chiropractors have stayed the same. Oh, this is interesting. When a parent uses a complementary method, the blue one, much higher likelihood that a child is going to use it. Whereas a parent did not use CAM, which is the red one, then very, very little chance that the patient, being a child, is using a complementary method. Similarly, if some other relative using it, there's again higher likelihood. So it goes from the parent or the relative to the child. Oh, how much are we spending? Oh, surprise, man. $2.2 trillion is the average spending as of 2007, okay, for all form of medicine. And then out of that, let's see, conventional out-of-pocket expenses is $286 billion because not everything is covered by insurance. Then look at this. CAM, which is out of the pocket mostly, except for maybe a few things like acupuncture, etc. $33 billion is being used for CAM, complementary and alternative medicine. But let's see what kind of split up. Look at again in this small orange thing, non-vitamin, non-mineral, natural products, 14.8 billion. Like, buying over-the-counter fish oil, over-the-counter echinacea, is easy CPAC, which is coming out recently. Other CAM expenses such as massage or chiropractor, etc., 7.2 billion. And then paying to the practitioner for practitioner fees, about $11 billion, right? And now what about, the split up of 2002, 2007, and 2012? Well, we see that non-vitamin minerals, non-mineral dietary supplements. Okay, this is not like calcium, vitamin D. No, this is besides those. An example I'll be showing in the next few slides. These numbers are in thousands. Okay, so 38,000 thousands, which is 38 million people are using as of 2002. And now in 2012, 40 million people have been using some form of non-vitamin, non-mineral dietary supplements. Another example, deep breathing exercises. By the way, deep breathing exercises, you may think, oh, what's there in deep breathing? Well, let me tell you a simple technique. Whenever we try to take a deep breath, we are so used to using the top parts of our lungs. Whereas we know from various traditional methods and based on conventional medicine physics that most of our VQ matching happens in the lower lobes. And therefore, a better way of deep breathing exercises is actually when you push your belly out, you breathe in, and making use of your belly to breathe, right? That way, not only are you getting deeper breaths and greater VQ matching, but also you're moving, enabling peristalsis in the gut. And I will be talking about gut being a core of health in these coming slides. So you may say, oh, what's there in deep breathing exercises as a complementary method? But there is so much detail to these deep breathing exercises. You can understand only when you start reading about it or accessing YouTube or other resources. So 24 million people are currently using some form of deep breathing exercise techniques. Yoga, Tai Chi, Qigong, 22 million in the US, okay? And I think the current population is 300 and something billion, 390 billion in the US. Meditation techniques, transcendental meditation, mindfulness meditation, those are some examples. Special diets I'll be talking about very soon. Let's see about acupuncture, 3 million, okay? And energy healing, naturopathy, Ayurveda, Indian traditional medicine, 240,000 people are currently using. All right, so that's the current, most recent figures. Talking about diet, you may have heard about Atkins diet, Northern European diet, driven by fish, meat, and so on. Ornish diet. Have you guys heard about Ornish diet? Dean Ornish, a cardiologist from UCSF, has done an excellent job trying to maximize the role of cardiac rehab with a diet and lifestyle program for coronary artery disease patients and also for prostate cancer and many other kinds of patients. And in fact, I believe Bill Clinton has access to Ornish diet at some point of his life. So for CAD. So Ornish diet, 77,000 people at some point of time in 2007 were using Ornish diet. Okay. Diseases. What are these kinds of diseases where people are using CAM? Well, the top seems to be back pain, 14% of the population that's using a CAM. It was for back pain. And the neck pain, 7.1%. Joint pain or stiffness, arthritis. Cardiovascular conditions, 5.5%. Arthritis, gout, lupus, fibromyalgia, anxiety, depression. I don't see pulmonary conditions in the top 6, but nevertheless. 10-year trend of natural products. Initially, in 2002, as you see on the left, echinacea was the top non-vitamin natural product. Echinacea is a flower and has excellent properties of helping with respiratory function and mucus production and improving immunity for the respiratory system. And people use it usually during the cold seasons, flu seasons, etc. Easy C-Pack, for example, is one of these products that's available these days in CVS pharmacy. It's being a competition to Z-Pack. And others you can see are ginseng. A form of that ginseng is ashwagandha, which is known to calm the mental system from the Indian tradition. And there's also American ginseng that's available. Ginkgo biloba, garlic supplements, right? Garlic is known to kindle the digestion. And we know that when you digest better, you have better health. Peppermint, fish oil, right, was down at 11%. And now, 2007, did you just see what happened? Fish oil just shot up all the way up to the top in 2012 on the right panel here. Probiotics is gaining interest, right? And melatonin is also getting interest now, right? Okay, so that's about natural products. What about yoga, tai chi, qigong? Well, you see that 2002, 2007, and 2012, yoga has continued to increase from 5, 6 to 9, 1.3, 1.0, 1.1% of the population for Tai Chi, and Qigong continuing to be around the same values. And yoga and meditation has also improved or increased in frequency of usage. Chiropractors have stayed status quo. Let me quickly give you a summary of yoga compared to pulmonary rehab, and then we'll end this part 1, and then we'll go on to the next part 2 video. So yoga was found to be as effective as standard pulmonary rehab. Chest article, okay, ACCP. So 60 patients, COPD, randomized to 2 groups. They were taught yoga poses and pranayama meditation and breathing techniques versus conventional pulmonary rehab, which is usually a 12-week course. 1 hour of training for 2 times a week for 4 weeks, followed by 8 weeks of supervision once every 2 weeks. And the remaining were home sessions. Well, what did they find? They looked at CRP, IL-6, 6-meter walk distance, Bogue score, and quality of life. And you see that yoga pre versus yoga post 12 weeks, CRP levels dropped. Okay, IL-6, which is usually a protective cytokine, increased from 23 to 32, 6-meter walk distance 419 to 456. Bogue score 1.5 dropped to 1.4 or 1.0, and quality of life scores improved, p less than 0.05. So all these asterisk marks suggests that it's all p less than 0.05. Okay, and what about rehab? Similar, 1.15 improved to 0.8, and similarly an increase in IL-6 from 6 to 36, and 391 meters, 6-minute walk distance improved to 424. Okay, and Bogue score 3 came down all the way to 0.5. Right, so so what can I take out from this paper? Well, I see that there is a lot of trouble in getting patients to pulmonary rehab. Insurance issues, distance traveled by the patient. If that's a problem, all this paper says is that, hey, why don't you consider yoga? It seems like it's as good as pulmonary rehab for these patients, right? There is metro parks all over these cities these days that offer yoga. There is community halls, YMCA, and in any job location, there's always some workplace benefits that teach yoga, or even in the gym memberships that are as part of insurance coverage, there are yoga programs, right? So try to encourage these patients to just encourage them and let them know about it, and they'll figure it out. Next, Tai Chi. Tai Chi as part of daily health used to be a form of martial art, still used in Asia. Defense, meditation, exercise, and stretch stability, any purpose from these four can be benefited. A significant workload to the cardiopulmonary system and musculoskeletal system because it has a combination of soft movements, coordination, breath control, and mind regulation. There's so much going on there, and you look at them and you say, "What the hell are these guys doing?" No, it's really uh, it's something that you need to experience to understand what it is. Fibromyalgia, Parkinsonism, falls. There's already research showing benefit for Tai Chi. Now, again, a chest article. 120 patients randomized to Tai Chi versus pulmonary rehab for 12 weeks, 55 patients. Each group completed the study. All were bronchodilator naive. They were taken from the community, and indacaterol was begun during the 2-week run-in period, ranging FEV1s with 25 to 79%. They had 1-hour training sessions, 3 to 5 times a week. Mean FEV1 was about 43%, 1.1 liters. And what did they measure? St. George's Respiratory Questionnaire. There's a series of questions that people ask about, hey, how are you feeling? How bad is your cough? How bad is your your daily activities being affected by COPD? And they looked at visit number 3, 6, 9, 12, 24. Okay. What did it show? Well, we see that only FEV1 and FVC, there were no changes. So it doesn't seem to actually, over these 24 weeks or so, it did not change significantly the actual lung function itself. Okay, however, with what you have, Tai Chi and pulmonary rehab seems to work around the musculoskeletal system and the cardiopulmonary reserve. For example, SGRQ and probably the psychic stimulus from the breathlessness, right? SGRQ scores dropped significantly, 31 all the way down to 12. And similarly, for pulmonary rehab group, 29 all the way down to 14, and all were significant, statistically significant, right? And 6-minute walk distance, 561 improved to 588, and that is statistically significant. And here in this population, the pulmonary rehab guys did not show actually a big benefit in 6-minute walk distance, although we know in other studies that 6-minute walk has improved with pulmonary rehab. And MMRC scores dropped, right, from 1.5 down to 0.7 on an average. And similarly in the pulmonary rehab group. And more importantly, quadriceps muscle velocity of contraction, very nice parameter, 33 increased to 40. So there's increase in the volume of the muscle. So they continue to follow these patients at 24 weeks. And guess what? They monitored these patients with home actigraph to make sure that they're actually exercising equally. And the benefit of Tai Chi seems to, the blue lines seems to have continued beyond 12 weeks, all the way to 24 weeks. The SGRQ scores continue to drop. Similarly, the MMRC that you see continued to drop. However, pulmonary rehab seems to have lost track because maybe the amount of equipment that they have at home may not be enough, but I'm trying to figure out why. So maybe this study again says, hey guys, if you have trouble with pulmonary rehab, please consider Tai Chi. Please tell them about Tai Chi and get them exposed to these things. Systematic reviews also have been done for Tai Chi compared to no exercise versus Tai Chi compared to some form of physical exercise. And they showed that, as you see here, the forest plot showing that for 6-minute walk distance, yes, favors Tai Chi and compared to no exercise. That's no brainer. We know that Tai Chi is something better than no exercise. Whereas when you see Tai Chi compared to physical exercise of any kind, still favored Tai Chi if you see in the right corner bottom. And similarly, you have SGRQ scores, right? Health-related quality of life. Again, Tai Chi was favorable compared to no exercise, and also for same comparison between Tai Chi and physical exercise, there is data showing favorability to Tai Chi. And mindfulness, mindfulness-based stress reduction and transcendental meditation are two major brands that we know of in the US and worldwide. And UMass, University of Massachusetts, was the one who came up with mindfulness-based stress reduction as a program, although it originated all the way back from Buddhism, from East. And here they've looked at asthma quality of life scores, which improved when somebody had mindfulness-based stress reduction. However, there was no change in the lung function. Similarly, here you see transcendental meditation has been documented as the only meditation practice that has been actually shown to lower blood pressure, according to the American Heart Association. What more, guys, do you need to prove? Okay, so we'll stop right there, and we'll continue after a few questions and a short break, and we can see you on the next set of slides and continue the video from there. Okay, thank you for joining us, guys.